I'm Ben Gonzalez, and this is TDI. Well, Medicare open enrollment begins October 15th. Medicare is a federal program, so not something that TDI regulates, but we do want to help you get you to the right resources. So joining us today is Yvette McVeigh. Yvette's the lead benefits coordinator at the Area Agency on Aging for the capital area. Thanks for being here today, Yvette.
Thank you for having me.
You bet. Well, your office, of course, covers Austin, Central Texas, but wherever you are in Texas, there should be an Area Agency on Aging to help the community, correct?
Correct. Just look for your local, you can do Area Agency on Aging or your local SHIP office.
Okay, sounds good. Well, today we're talking about the open enrollment period for Medicare. So how long is this enrollment period and what happens during this time?
So, open enrollment is about to begin. It starts October the 15th through December the 7th. During that time, it gives you the opportunity to change any of your Medicare plans, your Advantage plan, your drug plan. It allows you to sign up for Medicare if you haven't signed up for Medicare. So it just gives you the options to kind of right your wrongs. So if you've gotten a plan that you're not pleased with, this is the opportunity for you to change that plan.
So what kind of things might make it the wrong plan? What are the key differences between Medicare plans?
So I think most people that call, sometimes their doctor does not take a particular plan, or the drug coverage that's attached to the plan, or the standalone drug coverage of Part D does not cover their prescriptions. So they tend to want to change it. Or if they have an HMO, then they want to go to a PPO, because if you have an HMO, of course, you have to go to your primary care doctor to get a referral to like your physical therapist or some type of specialist. And then if you have a PPO, well, you don't have to do that. You can just go to the doctor as long as he takes your plan. So those are some of the things that people may get into and decide, well, I don't like this. Let me change, get a PPO, or let me get something that has more coverage, or something that my physician takes.
So sometimes you actually have to experience the plan to know what works and what doesn't work for you. And now's your chance to make some adjustments.
Right.
Well, you mentioned some of the different plans. Are these the same as what we call Medicare Advantage plans, or are those something different?
No, so you have the Medicare Advantage plans, and then you have the Medigap plans, which are the supplemental plans. So those are the two differences. So your Medicare Advantage plans, it bundles, I call it the bundle package. It bundles parts A, B, and D, as in dog, together. Whereas the Advantage plans is a supplemental plan, which covers that 20% that you're responsible for if you remain on the traditional Medicare.
Okay, so for people that have not been on Medicare before, there are portions that you may be responsible for, and so that's where some of these extra plans can help out?
Correct. So, if you're new to Medicare, if you're turning 65, you choose your plans at 65, and then, of course, during open enrollment, we give you the opportunity to see if those plans really work for you or fit your need. So, yeah.
Very, very good. Well, one of the things we hate to talk about, but we have to talk about, is scams that are out there, and people that may be targeting, because we know a lot of people are going to be looking at these plans right now. Any red flags that we want to tell people about, things that they should look out for?
So, of course, COVID-19 is out there, and then the new Delta variant and additional variants that are coming behind the Delta variant. So the biggest scam that's going on right now is the COVID vaccine. People are calling and scamming people, any way they can get your Medicare information, then that's what they'll do. So anything that's new, so this COVID has been around for going on 2 years. So they're using that to get information to file claims on your Medicare. So be careful when people come to you, oh, we can offer you free vaccine, which there are legitimate offers for free vaccinations, but go to people that Walmart, your local CVS, your doctor. Don't trust someone you don't know with your information.
Yeah, definitely. The COVID shot should definitely be free, or at least free to you, no out-of-pocket costs. So,
and what they'll say is that it's free. We just going Medicare will cover it.
Yeah, we just need your information.
We just need your information, and then your information is out there for them to cover a broad spectrum of things outside of COVID. I mean, they have a wealth of things they can charge to Medicare once they get that information.
Yeah, that information is private, and you should make sure to protect it as much as you can.
Yes.
Well, if someone is keeping the same plan that they had the previous year, do they need to do anything during this enrollment time?
Nope, you don't have to do anything. If you're happy with your plan, just go on about your merry way. This is only for the people that are not satisfied with the current plan. Then you can call us and we can help you walk through your transition.
Oh, that's perfect. So if they need help choosing a plan or getting to a plan, who can they talk to? So they call your office?
So they can call our office. Like I said, we are, some people, sometimes when you call Medicare, because they will reach out to Medicare and say, well, I don't like this plan. And then they'll say, well, call your local SHIP office, which is your state health insurance person. And then you can, that's us. That's the BCs. That's the benefits counselor through the area agency on agency. So just reach out and give us a call. We are doing face-to-face contacts. You can come into the office, but we do highly recommend that you call and set up an appointment so there won't be no crossovers, because we are still using precautions. We're wearing our masks. We're cleaning the area. But you can contact us. We can work with you over the phone. We even do, Zooms or Teams or go-to meetings if you have access to that, and walk you through choosing the plan that's best for you.
Well, great, Yvette. Thanks for being here today with the information, and hopefully we've helped some people. I have a number here for area agencies on aging, 800-252-9240. And so depending on where you are in Texas, you can get to your local area agency on aging through that number. If you have questions about other types of insurance, be sure to check our website. It's tdi.texas.gov. And we also have a helpline number where you can ask general insurance questions. That number is 800-252-3439. So for Yvette McVeigh, I'm Ben Gonzalez, and this is TDI.